Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Greetings and welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Behavioral, thank you for joining us. Your mental health influences your thoughts, emotions, relationships, and daily functioning. Supporting it leads to better stress control, greater resilience, improved physical wellness, and a more fulfilling life. So to help Rio Grande Valley residents prioritize their mental health, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. By educating the community on mental health challenges many in our community face, along with guidance on how to navigate them, we hope to break the stigma and empower more people to talk about their experiences and get professional support when they need it. Now, in this installment, we'll discuss alcohol use disorder. Far more common than many realize, alcohol use disorder affects nearly 30 million Americans ages 12 and older per the CDC. That's almost 1 in 10 people. And when even one person struggles, the effects ripple outward, touching the lives of countless family members, friends, and loved ones who share in the worry, stress, and heartache that often accompany this condition. Beyond straining relationships, finances, and family life, untreated alcohol use disorder can have a profound impact on a person's physical, mental, and social well-being. It can lead to serious medical conditions, including liver cirrhosis, certain cancers, and cardiovascular disease, and significantly increase the risk of accidents, suicide, and violence. So to learn more about alcohol use disorders, we're joined by Alberto Guerrero, a licensed chemical dependency counselor with STHS Behavioral. Alberto, thank you so much for joining us.
Thank you, Tom. Nice being here.
Now, when you hear that number, 30 million Americans, does that surprise you?
Not really. Alcoholism or alcohol use is very prominent. It's socially acceptable. It's a cultural thing. You'll find that many people, when discussing this, find that it's normal to have a couple of beers here with family or friends, and it's socially acceptable, so people don't feel like it's an issue.
And when you see people having alcohol, you go to the big game or you're watching sports on television or whatever it may be, it is that social aspect of drinking. And so do you think people notice the signs?
That's the thing. In regards to alcoholism, sometimes it's under the radar. So many people widely accept it, don't see it as it being a problem. And then you'll have the same person that's excessively drinking at a football game or at a family barbecue and then continue drinking when they get home. So yeah, sometimes they do keep it well hidden. In other cases, it just gets out of control over time.
And you hear sometimes about a functioning alcoholic, which used to be what was said back in the day before they changed it to alcohol use disorder. So you have people who are still able to fully feed their families, go to work, keep their jobs, all of that. So that makes it even more challenging to really understand the impact.
Yeah, I don't know how many times I've heard a patient tell me, look, if I'm paying my bills, if I'm providing for my family, if I go to work every day, what's the problem? I deserve it. You know, I don't feel like anything's wrong with it. But over a certain length of time, 20 years, 25 years, your body gets accustomed to this. And without alcohol, they won't be able to function. So it's actually opposite of what you would consider a healthy lifestyle, you know. And over time, you're hoping that this person will slowly realize that drinking a 6-pack or 8-pack every day, and your body's used to it, when they're deprived of that, there's severe agitation, there's anger. They're hard to be around, believe it or not.
And at STHS Behavioral, what percentage of patients do you think are dealing with alcohol use disorder or substance use disorder?
60% of people that come into our clinic or our establishment are dealing with some kind of substance use disorder. It could be nicotine, it could be alcohol, it could be illicit chemicals like methamphetamine, opioids, It could also be prescription medication abuse. So we see all types of substance abuse issues, and sometimes, like I said, some are worse than others, but the majority of people that we get at the facility are coming in for alcohol use or alcohol abuse.
And when you hear the ages, 12 and older, 12 seems like such a young age. You're not even a teenager yet. You're in the tween stage. Does that surprise you to hear that age?
It just depends. I mean, sometimes yes, sometimes no, and I'll explain. When you have a parent that often uses alcohol or drinks there, and they feel like they'd rather have their child there with them, sometimes they'll offer them a drink so they can stay there, have a chat, you know. Maybe they see it as a normal thing, which is actually not the case. And then you have other situations where kids might be associating with older adolescents and are offered a drink for the very first time and start that progression slowly. You know, every time they hang out with their older brother or an older sister, they're offered a drink, and it becomes a normal part of their life, you know, over time, even though anybody else would see it as a dysfunctional kind of relationship.
Now, as a licensed chemical dependency counselor, do you see any sort of a common thread when it comes to alcohol use disorder? Is there the same excuse as I really didn't realize I had a problem, or is there any sort of thread that you notice in many of the patients that you encounter?
Most of the time when I'm talking to someone that might be dealing with an alcohol use disorder, it's already out of control. You know, in the process of getting to that point, it's part of their daily lifestyle, daily ritual. They don't see that anything's wrong with what they're doing. Why would they? They've been doing it for so many years. It's situations where there are functioning alcoholics until they reach a point of dysfunction. And then that's when the issue comes about. That's when they might end up showing up at our facility because everything's just gone awry. They can't handle their job. They can't handle relationships. They're dealing with legal issues. There's a whole different aspect of what's going on with their life, and it's all negative.
Do you think that there's enough awareness in our community about alcohol use disorder and recognizing when someone may be having problems become more serious, things like that?
I think people know, maybe in the back of their mind, but when it's dealing with a family member, they feel like, well, I'll let their mother or their father deal with it. They might see erratic behavior and feel like, well, you know, I know that they probably already talked to him or her. It's just the difficulty lies in the social aspects. Is it culturally accepted? Is it a big deal if they're drinking at a family barbecue? What's the deal? You know, maybe they did drink a little bit more than usual, but that's okay. You'll have people that enable them, very codependent type people, because they feel like there's nothing wrong with what they're doing. You know, it's just, you know, let them blow off some steam, let her, you know, have some fun, big deal. And it's that covering up for that person that could make that situation way worse.
Well, I think that's why education is so key, and you have put together a great presentation to sort of help walk people who are watching through understanding alcohol use disorder and its long-term impact on individuals and the community as a whole. So let's get started.
Okay, great. Okay, just to break down the statistics, we have 84.1% of people ages 18 or older that have reported that they have consumed at least one alcoholic beverage at some point. This represents 215.6 million people in the United States. And the breakdown is 107.5 million men ages 18 or older, or 108.1 million women 18 years or older. Now, this is a key demographic information that came out just recently for 2025. And this is the trend for alcohol-related deaths. Excessive use of alcohol is responsible for approximately 179,000 deaths annually. Now, because of this, the breakdown that they have established is that 120,000 of these deaths are attributed to men, and 59,000 of these deaths are attributed to women. Now, there is an increased risk for cancer as well. 20 to 23,000 deaths per year are going to be linked to alcohol consumption or overconsumption. And California recently did a study, and they projected, this is based on 5 years of study, that they're estimating the projected fatalities due to alcohol-related deaths, driving while intoxicated, driving under the influence, will be between 1,300 and 1,400 people. This is annually. Now, Dr. John Ewing came up with a test. He is the director of Bowles Center for Alcohol Studies, and it's a 4-question test. And basically, what he stated was, if you answer 2 out of these 4 questions, yes, you might have a problem with alcohol. Have you ever had the inability to cut down your drinking? You try to limit your drinking, but you can't do it. This is a person buying a 12-pack of beer and saying, I'm just going to drink 6, but by the end of the night, all 12 beers are gone. Do you become annoyed when people ask you questions about your drug use? How much have you had to drink? How long have you been drinking? What tends to happen in these kind of situations is that sometimes a person will feel like, in order to avoid those kind of situations, they'll isolate themselves and start drinking alone. Do you feel guilty about the money you're spending or the lack of time you spend with family? When you start drinking and you start becoming dependent on alcohol, alcohol use is now your priority. You prioritize your drinking. I actually had a patient that told me one time that he asked me a question and he said, hey, why is it I'm okay with spending $50 on 2 cases of beer, but if I spend $15 on a pizza, it's too much money? And basically what I told him was, because you prioritize your drinking. And he realized that. And in the morning, you know, they call this hair of the dog or an eye opener. Do you often have a drink in the morning to ease your hangover? I need to mention that when a person consumes alcohol, 1 or 2 beers in the morning to get over a hangover, they're just reactivating their drunk. They're not getting sober. Your body is extremely dehydrated. You need water, Gatorade, Pedialyte, anything like that that's going to replenish the fluids. That's one of the reasons the person is experiencing a hangover. Now we have the progression of alcoholism. Stage 1 is heavy drinking that leads to the development of tolerance. Now tolerance is going to be a buildup of use, and basically it's defined as drinking more beer or more alcohol to get the same effect that you did before. So as your tolerance begins to grow, you're going to start to expect to drink more alcohol. Stage 2 is regular use of alcohol will slowly lead to memory lapses like blackouts. These are gaps in your memory. You can't really remember a lot of the things that happened. Who brought me home last night? Who paid for the beer? So on and so forth. You're going to be asking these questions. Stage 3, the individual slowly loses the ability to control his or her use over time. You start noticing that you're drinking more days out of the week than not. This is a telltale sign that you're starting to drink way too much. And stage 4, prolonged binges of intoxication, which can lead to mental or physical problems. Binge drinking is actually worse for your body. You're drinking more alcohol in a shorter period of time, so it's doing more damage to your body. Some of the health concerns that might be associated with a person drinking, the development of cancer after prolonged use of alcohol. This could lead to cancer of the mouth, tongue, throat, tonsils, and esophagus. A lot of people don't associate cancer with consumption of alcohol. Most of the times they're going to talk about cigarette smoking or things like that. But yes, excessive use of alcohol can lead to all these types of cancer. How would it affect your liver? Heavy drinking could lead to a fatty liver. Also, alcoholic hepatitis. This is when your skin starts to turn yellowish. The white parts of your eyes start turning yellow. And of course, the development of cirrhosis of the liver. This is when your liver is starting to shut down. It's not functioning at full capacity, and it's slowly starting to get worse over time because of your alcohol use. How does it affect your nervous system? Alcohol use disrupts nerve cells that could lead to memory loss, confusion, and disorientation. What happens is the use of alcohol depletes your body of vitamin B1, which is responsible for keeping you focused and keeping your memory intact. Excessive use of alcohol will deplete this and lead to memory loss, confusion, and disorientation. How does it affect your heart? Alcoholics are usually at higher risk of heart failure, high blood pressure, heart disease, strokes, and heart attacks. There's a buildup of fatty liver, fat cells around your arteries that are slowly clogging these arteries, which decreases the blood flow to your heart and could lead to all of the issues that I just mentioned. How does it affect your digestive system? If you already have a little bit of gastritis, alcohol use is not recommended. It's going to actually make your gastritis worse, which could lead to peptic ulcers and bleeding ulcers. These are other alcohol-related issues that could happen. People don't realize this, but alcohol is actually poisonous for your body. Your liver starts to work and goes into overdrive to try to get this alcohol, this poison out of your body quickly. Your liver can only process 2 beers an hour, a glass of wine, or 3 ounces of hard liquor. And basically what it's doing is trying to clean it out so it won't poison you. Most people tend to consume more alcohol as the time goes on, so this is a big issue. Alcohol replaces nutritious food and empty calories. So there is no nutritional value associated with alcohol use. Alcohol disrupts a person's body chemistry. So basically what's happening is you have low levels of sugar in their blood, which could lead to hypoglycemia. Alcohol could increase fat in your blood, which damages your heart, liver, and other blood vessels. After prolonged exposure, the body gets used to the presence of alcohol. This is when you start developing more of a dependence on alcohol. This process is called physical dependent and is reliant on regular daily consumption of alcohol. It changes your body chemistry and your brain chemistry. Once physical dependence to a specific substance occurs, an individual will develop withdrawal symptoms which he or she abruptly stop when they stop using alcohol. The CD estimates that 8 to 10% of people who abuse alcohol or are alcohol dependent will die from these withdrawal symptoms. Detox and or emergency medical services are recommended for these individuals who decide to stop the use of alcohol and have become dependent. Some of the withdrawal symptoms you might want to look at or might experience are increased anxiety and nervousness, delirium tremens or DTs called the shakes, confusion, increased blood pressure, hallucination, seizures, and long-term use of alcohol could also lead to dementia. Okay, relapse warning signs. A person that might be thinking about relapsing and going back to using might have some tendencies towards isolation. They might start experiencing minor bouts of depression, feelings of helplessness and hopelessness, irritation directed at friends and family, just very, very unpredictable in regards to overreacting to situations leading to stress and anxiety, poor eating habits, and inability to sleep at night. So what is recommended is that you seek detox services and or inpatient rehabilitation services. We have services that we provide there at South Texas Health System Behavioral, and we're located at 2102 West Trenton Road, Edinburgh, Texas. And if you need to get more information, call 956-388-1300. We also recommend outpatient services, intensive and supportive, aftercare service. And if you're looking for an AA meeting close to where you live, you can call 1-800-839-1686 and you find a meeting closest to you. And we also recommend that you seek sponsorship after being affiliated with AA, or at least try to associate with sober buddies.
That's some great information there, Alberto. Now let's go into a little bit of the numbers again. So we talked about the 30 million, but let's break it down. So about 16.4 million men are suffering with alcohol use disorder, and about 10.7 million women. So it is more men, but there is a large number of women. Do you see a difference when it comes to seeking treatment when they come in sooner? Is it men or women who notice it faster?
I think we've seen a trend where women feel like their life is slowly getting out of control and will probably admit that they do have a problem with alcohol. Men are more reluctant. It could be a cultural thing. You know, some people have said machismo and not admitting weakness. But yes, and actually the numbers of women that are consuming alcohol in excess have actually steadily been going up over the last few years.
So you're starting to see a little bit more of a rise in women suffering with alcohol use disorder.
Yes, correct. And the thing is that when we talk to some of these patients, they mention the frustration of being at home, raising the family. Sometimes the roles haven't changed from the 60s or 70s. Husband goes out to work, the woman stays home with the kids. It's very stressful, and women are trying to deal with it as best they can. So what they do is, if they have an opportunity, maybe they have a drink or two. But over time, it's not 1 or 2 drinks, it's 5 or 6 drinks. And then it's starting to get slowly out of control over a certain period of time.
Now, we talked a lot about the impact of COVID during 2020, 2021, 22 into 2023. I mean, we were dealing with it for a good 3 years.
Right.
Did you see more of an increase? We talked about the impact on mental health, depression, anxiety, but did you also see an increase in alcohol use disorder?
Yeah, they did a study and they found that alcohol use increased about like 22% over that time. Drug use about the same as well. The number of divorces also increased during that time. I guess the alcohol and the drugs ran out. I'm not sure, but it was very difficult to live with a person, especially during the quarantine period. And because what they thought was, okay, in order to deal with this boredom or not being able to go out, let's start drinking. And it actually made things worse with a lot of relationships. There was a massive increase in divorces during that time.
Now let's talk about adolescence, because people think, okay, it's alcohol use disorder doesn't really affect people who are teenagers or even tweens. So about 732,000 adolescents between the ages of 12 and 17 had an alcohol use disorder in 2023. So that goes to show that it does impact our children.
It does. I mean, the thing is, what you see is parents that drink maybe on a regular basis and have alcohol, maybe a wine cellar, or they have bottles of liquor there, and kids, due to a lot of the curiosity, is they start tasting it and drinking it, and as time progresses, I mean, I even talked to this young girl that told me that she would get her father's vodka bottle and steal a lot of the vodka and then fill it up with water and close it up and just leave it there, because the need to start drinking. And I also talked to this one young girl, she was about 14 years old. She said, in order to cope with what goes on in my home, I drink alcohol. But what happens, because alcohol is a depressant, is that at first I'm happy, I feel great, and then I start crying after about 2 hours of drinking. And I just, I told her, well, you're drinking a depressant, and eventually it's going to bring out those type of emotions. So in order to cope with a lot of what's going on, not only in their home life, but dealing with their mental health diagnosis, sometimes they seek alcohol. Sometimes there's a chemical imbalance that's going on in the brain, so they're adding something to just feel good or feel happy. And over time, they could get dependent on alcohol.
So knowing those numbers that we just talked about when it comes to 12 to 17-year-olds, what advice do you have for parents when it comes to keeping an eye, because they are at that age where they're curious and they're more, it's more accessible, their peer pressure is more common. So what advice do you have for parents?
Well, I mean, try not to leave access to alcohol, around the house. That's one of the main things. Accessibility, and what you'll find after talking to so many young kids, is that they will take opioids from their parents' medicine cabinet. They will take a benzo if they're dealing with anxiety. And of course, if there's alcohol, they're going to get to it. So make it a little bit more, keep it under lock and key, things like that. Don't give them easy access, because if you start noticing, hey, who drank my liquor, or why am I missing beers, then you might want to look at, okay, maybe it's one of my kids. So don't make it easy for them. Make it as difficult as possible in that respect.
Now, when it comes to treatment, there is a huge gap, with only about 7.9% of people in the last year with alcohol use disorder receiving treatment. Does that surprise you to know that people aren't getting the help they need?
It doesn't surprise me. Many people feel uncomfortable going into places. And I actually told patients, and I try to explain this to them, when you walk in those doors, you're probably one of the bravest person that you know. Even though some people might see it as a weakness, I see it as a strength. It's very difficult for you to admit that you have a problem with alcohol or drugs and walk into a facility asking for help. And when they're there and they start feeling comfortable, they realize, hey, they're here to help me. So I really am grateful for everyone, all the therapists, all the nurses, everyone that's there, that's trying to make the effort to make their life a little bit better or improve their life, and trying to prepare them when they go back home. That's very key, because they have to understand what may have brought them to that facility, they actually have to go back to after a certain amount of time. So better prepare themselves mentally and emotionally to deal with that.
And obviously, when we talk about the long-term impacts of alcohol use disorder, we talked about all of the different conditions that a person may encounter, but mortality is a serious threat if you're not careful. Alcohol-related deaths have increased to approximately 178,000 per year, 29% increase from 2016-2017. So we're seeing more loss of life. And when we talk about the health impact, alcohol causes roughly 4 million years of potential life lost in the U.S. So you are slowly ticking away your time clock when you are drinking, and the more you drink, the shorter lifespan.
That's
you're
right.
gonna have.
You're shortening your lifespan. Remember, you're drinking a poison that your body's normally not used to taking. Even though you've built a tolerance to it, your brain will tell your liver, hey, get this out, metabolize it as quickly as possible, because we cannot have this in your body. Most people that die from alcohol poisoning have consumed too much alcohol in too short period of time, and their liver could never catch up. And then once your liver shuts down, the rest of your organs start shutting down. So yeah, it does hinder your life. And over time, you'll start noticing that it affects not only what's going on in the inside, we usually can't see that, but how the person appears on the outside. So it's doing a number on a person over time, yeah.
Now let's talk about the causes of alcohol use disorder. So we hear that it can be hereditary, so the genetics play a role. Do you see that a lot with patients who say, you know what, my father, my grandfather were dealing with alcohol use disorder, and you see that sort of resulting in them?
There are numerous factors, and they've done research on both genetic predisposition, and they've done about the social environment. And basically, it could be one or the other, or a combination of both. If your father's an alcoholic and they have a history of abusing alcohol, then you have access to alcohol, because more than likely they have alcohol hidden there. I've talked to adult patients who said that they sometimes hide their beer and their liquor around their home, and maybe one of their children might come across it and then take that bottle or that beer can and drink it. So what I'm saying is, if there's availability, then a child will probably have access to it. But genetic predisposition has been proven. Also, lack of supervision plays a big part. If I'm getting all my advice from my older friends and mom and dad, of course, mom and dad might have to work, but you have older kids, maybe a few years older, that are drinking and around somebody that's they can be very influenced by their drinking. They'll start to drink because they want to fit in. So there's numerous types of factors that can be involved.
Mm-hmm. I remember speaking with somebody that we were interviewing who was living with alcohol use disorder, and he mentioned he was about 12 years old, mm-hmm. and he took a sip and instantly felt the whatever that rush was, and it stayed with him, and it just became a pervasive problem over time.
Yeah, there's many patients that have told me the first time they had an alcoholic drink, it was the best thing they ever tasted in their life. And then you come to find out that their parents were alcoholics, their grandparents were alcoholics. So yeah, it falls into that theme where you have people that have a history of alcohol use throughout their family. So they have that risk, like I said, there's people that have never had a drink, but they don't become alcoholics because that's all they were surrounded with. These are everyone that I associated with was drinking. So I started drinking and I got used to it, and my body changed and I needed it now. So mm-hmm. I've seen both sides, yes.
And we obviously have to be really careful with those social and environmental factors. So too much stress, if you're not managing the stress properly as an adult or as a student, and you're working and you're not managing the stress, you don't have an outlet, and you may turn to alcohol to sort of numb the stress.
Yeah, that's the beauty and the curse of alcohol. You forget for a while, people that have financial issues, dealing with relationship problems at home, just a whole mess of things that can push you in that direction. If you already have depression, it will make your depression worse. Anxiety could very definitely increase over time from drinking, and it's just leading to a whole mess of other problems.
Mm-hmm. And over time, obviously, drinking alcohol impacts the brain and how it functions, right? It impacts everything from pleasure, judgment, and the ability to exercise control over your behavior. But it sort of just takes hold.
It does. It slowly, your brain chemistry changes over time. So what you're finding out is, say I've been drinking every day after I get out of work. Well, after a while, you'll start getting a message like right before work, hey, don't forget to pick up that 6-pack. Don't forget to pick up that 8-pack. That tends to happen over time. And it's like it becomes muscle memory, because your brain's already so used to it, and your body chemistry, your body's so used to having alcohol inside that it needs it, and it's telling you, don't forget to pick up that beer or pick up that bottle of wine, whatever. And you'll find that you're negatively reinforcing that behavior every single day you do this.
Now, you talked about the stages of alcohol use disorder, the 4 stages. So the pre-alcoholic stage, stage 1, you talked about it's a kind of more social drinking.
Right.
And then the risk is that you feel good and you sort of want to feel good more often.
Yeah. What's basically happening is your body's getting accustomed to a certain pattern. And if you continue that pattern, you'll start finding out, hey, I remember I only drink on Friday and Saturday. Now I'm drinking Wednesday, Thursday, Saturday, and Sunday. Now, so your pattern starts to change. And then before you know it, you're drinking every day out of the week, you know. And that can happen over time, you know.
And obviously you progress into early stage alcoholism where you sort of, your drinking becomes more frequent as you talked about. It can involve binges, memory blackouts, occasional negative consequences. Then you move into the 3rd stage, that middle stage where you're significantly, it starts impacting your work, your relationships, and your daily functioning. And then it goes into that late end stage alcoholism where it's just complete loss of control.
It is. I mean, that's what I'm saying. There's people that say they're trying to avoid a person hitting rock bottom, and I understand that logic. But when your life starts slowly becoming unmanageable, getting out of control, and you're inundated with problems at home, legal problems like I mentioned earlier, inability to maintain any kind of relationship, problems with your co-workers, things like that, it starts to weigh on the person, and they start losing employment. Like I said, they're not able to pay their fees for probation or parole. Their family is on the brink of breaking up. All these things are starting to happen all at one time, and this person may not realize that the main factor is their alcohol use. So they have to maybe sometimes get to that point to realize, okay, I need to stop. I need to do something different because I see everything falling apart around me.
Now, these stages, can they evolve quickly? Like, can you progress from 1 to 4 pretty rapidly?
Oh yeah, I mean that can happen very, very quickly. And there's people that say, well, you know, I didn't really start off at, and a lot depends also on the age they started drinking. If they're drinking at age 15 and they're already drinking a 6-pack or a 12-pack, when they get to an age where they're able to work and, you know, maybe have a relationship or so on and so forth, they may have already passed to the 2nd or 3rd stage, you know. So a lot has to do, and like I said, you can also add the family history of alcohol use, just the progression. Real quick, I mean, I've talked to patients that said, oh, sir, I started off with, you know, 1 or 2 24-ounce beers, and before you know it, I was drinking like an 18-pack every day. And it happened within a couple of years, you know, so it can happen quickly. It varies from person to person, of course.
Now, we hear a lot about binge drinking. So people, it's a holiday, so they may drink a little heavier as they're celebrating with friends, the new year, whatever it may be. Even binge drinking can become a serious issue.
Yeah, there's such a thing as a weekend alcoholic, and these are your binge drinkers. They drink right after work on Friday, they drink most of the night, maybe till the morning on Saturday, drink Saturday again, follow that pattern and drink Sunday. They're drinking more alcohol in a shorter period of time. And these are the people that tend to have more health-related issues than your regular daily 6-pack drinker, because too much alcohol, your liver's working really, really hard to try to get this cleaned out of your system. Also, there's research out indicating that a man and a woman could start drinking at the same age 21, and by the time the woman's in her 40s, she'll start having more alcohol-related health issues because of her drinking as opposed to a male. I don't know why, but that's the research that they have so far.
Wow, so women should really be paying attention, especially with just any alcohol consumption, because we always talk about the average drinks that the daily limit that a person should have. So it's usually 2 drinks for men,
right,
1 for women, and
right,
that's probably a good reason why.
The CDC says that what they could consider a dangerous level is when a man has 5 or more drinks per sitting, and if a woman has 4 or more drinks per sitting. So limit your alcohol use. And it's okay, you know, 1 or 2 beers, or 1 beer with a meal and then another beer with another meal, or a glass of wine. Wine actually has more alcohol than beer, but overall they found that it's healthy, but it's the excess use of alcohol that really causes the issue.
Now let's talk about those symptoms, so that way people may recognize some of those signs. So obviously being unable to limit the amount of alcohol you drink. So over time you're just imbibing more than you would to kind of get the same feeling that you would get with that first drink that you had.
That's correct. Basically what's happening is you feel the need to limit yourself because you're starting to realize that you have a problem. But what happens is you can't do it. That's when it's starting to become a problem.
Spending a lot of time drinking, getting alcohol, or recovering from alcohol use. So it's not just the drinking and the getting it, it's also then your recovery takes longer.
Oh yeah, that's the person that has a hangover and they're looking to probably get some more beers to get over their hangover. And basically what happens is it starts all over again. You start that pattern again. So you never stop drinking if you follow that kind of mentality.
Feeling a strong craving or urge to drink alcohol. So if you're getting that urge and you get to a social function or whatever it may be and you just feel that urge, that's a sign that you need to talk to someone.
It is. I mean, there's going to be situations where, and I've asked this to the group before, where there's 25, 26 patients and I ask them, when's the last time you went to a family barbecue and there was no alcohol? And nobody raised their hand because it's just part of the common thing. So some people actually refuse to go to a family get-together or a function if there is no alcohol.
Failing to fulfill major obligations at work, school, or home due to repeated alcohol use.
This is when the person's actually prioritizing and drinking over everything else. And as time progresses, that's the only thing that person is going to care about.
Giving up or reducing social and work activities and hobbies to use alcohol. So those are the people who sort of retreat so that instead of going out and spending family time, they stay home and have a beverage.
They purposely isolate themselves so for fear of judgment. It's easier for them to feel more comfortable drinking alone. And by doing this, they're actually cutting off ties with their close family and friends.
And then experiencing withdrawal symptoms, which you had talked about, the nausea, the sweating, the shaking, when you don't drink or drinking to avoid these symptoms.
Yeah, that's basically what happens is your body's reacting and it's telling you, I need alcohol in order to function. And this is the reaction you'll get. And if you don't consume alcohol, your best bet, and like I mentioned earlier, your best bet is to go to an emergency room or a detoxification center because you can be medically treated. 8 to 10% of those people will die.
And when it comes to the risk factors, so alcohol use can obviously begin at any age, but alcohol use disorder tends to occur more often in your 20s and 30s, though it can start obviously at any age.
Correct.
Some of those risk factors for alcohol use disorder include steady drinking over time. So if you just sort of keep going steady.
You're pacing yourself at a certain, yes.
Starting at an early age. So the earlier you start, the more risk you are for becoming someone dealing with alcohol use disorder.
Your 20s and 30s, by that time, what they've indicated by the CDC is that a person that starts drinking at age 15 is more likely to develop alcoholic tendencies by the time that they're in their 20s and 30s. So it's key that you don't allow your child to start drinking early because they will develop that want for using or drinking, and by their 20s and 30s they're already starting to drink on a regular basis.
Living with depression or other mental health problems. So you see that a lot in the clinical setting where there are comorbidities that they talk about. You have coexisting conditions.
Oh yeah, 60% of the people that we have in our facility are going to be dealing with some kind of chemical dependency issue, and they use it to try to balance out what's going on with them, either mentally, emotionally, or what's going on in their home life.
And then a history of trauma. So people who have a history of emotional trauma or other trauma are at increased risk for alcohol use disorder. So when we talk about trauma, when we talk about mental health conditions, it's really important to get the help for that underlying condition that is leading you to reach for the bottle.
That is correct. I mean, when you talk about people that are dealing with trauma, and I hear patients saying that they consumed alcohol until they passed out, not blacked out, but passed out, because they're trying to forget about a lot of the things that they've experienced earlier in life. I told them, well, you're just adding to your problems. You're gonna have to deal with your alcohol use later, eventually. So yeah, people do that to just cope with a lot of what's going on in their life.
And then social and cultural factors. So obviously having friends or a close partner who drinks regularly increases your risk of alcohol use disorder. So really just paying attention and surrounding yourself with people who you hope to aspire to be versus living with somebody who may lead you down the wrong road.
You just have to, if you're really committed to not drinking, you might want to say, like, I've had patients tell me, sir, you're telling me not to associate with people that drink, but everybody in my family drinks, so I don't hang around my family. And I said, well, you know what? You could stop by and say hi, and then say, well, I have to go, And there's going to be some family members that are going to support you, and they're going to say, you know what, mijo or mija, we understand, so your best bet is okay, we understand if you have to leave. Of course, you're going to have others on the other side that say, nah, just have a drink, so on. So you'll feel that pressure sometimes. And those are situations that you're trying to avoid.
And we obviously talked about the impact on your health. So liver disease, obviously it impacts the liver the greatest, I believe. So your liver is working extra hard to detoxify, so to speak. You get digestive problems. You have heart problems. So obviously cardiovascular disease is the leading cause of death in the US. Right. Diabetes complications. So if you're living with diabetes and you're drinking, you could experience some major complications associated with that. Issues with sexual function and periods, so menstrual cycles are impacted. Eye problems, so your vision is impacted. The risk of birth defects, bone damage, neurological complications, a weakened immune system, which means you're going to be getting sicker more often, an increased risk of cancer that we talked about, and then obviously you could have some impacts of if you take medicine and your alcohol. It could also cause some issues, complications associated with that.
There's some negative interactions when you consume alcohol and you're using opioids or for pain, say for example you're post-surgery, or if you're taking benzos for anxiety, this is your Xanax, clonazepam, and you're mixing alcohol with it, they contraindicate, meaning that it doesn't make a good combination. So you will try to avoid consuming any kind of alcohol when you're taking these type of medications. It also affects the efficacy of
certain medications
your mental health medications as well. So you have to be very, very careful.
And we talked about obviously the impact on health, but there's also the impact on your safety and the safety of others. So obviously we see motor vehicle accidents, you hear drunk driving, we have relationship problems, so it starts to impact the people around you, your poor performance at work or school, the increased likelihood of committing violent crimes or being the victim of a crime. Have you had that instance where you see somebody who say, hey, I'm not a fighter, but alcohol made them braver, and they end up in the ER with injuries?
There's just a massive release of different chemicals going on, glutamate, serotonin, dopamine, endorphins. When you consume alcohol, it has the ability to change a person from Dr. Jekyll to Mr. Hyde over a span of maybe an hour or two. And a person that's usually somber and quiet can become very, very aggressive. And there's more crimes associated with alcohol use in regards to aggressive acts of violence than any other drug. So you'll have DWIs. Sometimes you have these drivers that are very aggressive when they're driving, and then you have domestic violence, you have aggravated assault. All of these, a lot of times you're going to find out that were associated with alcohol use. You hear them all the time at bars and clubs all the time. So yeah, it does change your ability to control yourself.
Now let's talk a bit about some of the myths. So drinking 1 glass of alcohol a night has no impact on your health.
It does, but they usually recommend that if you consume an alcoholic beverage, you eat something, because the food that you're eating will absorb, and actually they find that it's beneficial, especially when you're talking about wine. There's antioxidants, there's other things like that, but going over that's when the issue starts to happen, where you start having physical or other issues going on with your body.
Now they used to always say 1 glass of wine a day, is good for you. Is that true still?
It is true, but if you notice, like the people from France, they eat a lot of very rich foods with butter and soaked in butter, and they're actually healthier than the people in the United States. Only because they have 1 glass of wine, they never go over their limit, they stick to that plan, and they eat something with it. In some schools in France, I've heard that they're taking away whole milk for some of the kids in schools and adding small amounts of wine with it so that they can eat their lunch. So, and they're finding that that's actually more beneficial. So it varies from culture to culture, but I would say that a glass of wine with food is okay. Just not going over that.
Yeah. Now, another myth, you're not in danger of health or addiction problems if you only drink alcohol socially.
That's not true. No. Yeah, the thing is, you're going to be attending social events, probably, not every weekend, but, quite often. And if you have a big family, you're going to probably be attending more social events. So the more social events that you attend, the more you drink. And basically what's going to happen is you're going to start developing a pattern, So if you have a history of it in your family as well, like we mentioned earlier, it is not a good idea to drink. Your best bet is to actually not drink at all, because a lot of people get to a point where they cannot limit their use. They'll drink 1 or 2 beers and they'll say, what's a big deal if I drink 1 or 2 more? So they follow that pattern.
So let's talk about quitting drinking. So we talk about just how challenging it can be for somebody, especially the longer that you've lived with it, the harder it may be to give something up. So let's talk about what happens after 7 days without alcohol. While you may get some issues with withdrawal, you tend to see some physical changes. So you'll have better hydration and skin. You'll have increased energy, improved sleep. You'll have digestive health, so better digestive health. Your liver will function better. Your blood pressure will be more regulated. So also mentally, you'll have clearer thinking, your mood will be stabilized, and you'll have sort of a sense of accomplishment, which is really nice to have. So 7 days, if you can commit to 7 days, you can start really experiencing a change.
Yeah, by that time your body's fully detoxed from the alcohol, and you probably won't have any shakes or anything like that, especially if you're going under like a medically supervised detox. And you will notice a difference. We'll have that energy, but the first 4 or 5 days, you're probably gonna feel very lethargic, and it's gonna be hard to get up out of bed or do much of anything. But over time, the longer you're away from alcohol, you'll start noticing the change. And like I said, I've talked to patients that told me when they're drinking, their job that they know, backwards and forwards, they struggle so much when they've been partying the day before, or the night before. So they struggle because it does affect your ability to remember, comprehend, and they're just throwing a monkey wrench into the whole situation. But yeah, your whole body will start to notice a difference after 1 week.
And then when it comes to obviously making the decision, you've committed to change. It's really important to set sort of goals for yourself, right? Like smart, realistic goals that that you're baby stepping to get better.
Right. Daily affirmations, letting yourself know that, okay, I made it 1 day. Okay, I'm going to concentrate on the following day. And then occupying your time constructively. These are coping skills where you find out, hey, you know what? Instead of focusing on me not drinking, maybe I'll go outside and wash the car, work on the lawn, just do things, arts and crafts, anything that's going to occupy your time constructively. Because a lot of times when you're dealing with somebody that's dealing with addiction or talking about addiction, they're focused on one thing and one thing only. So it's better to distract yourself with something that you find. And believe it or not, you might find that, hey, maybe journaling or artwork or anything is going to really help make you feel like you're productive and you're doing something different.
And when you're in those stages, whether you're at stage 1, stage 4 may be a little bit more difficult. You may need additional treatment options, but at least in the first stages, when you're setting those goals and you're working on yourself, you have to get rid of the temptation.
Exactly. No, I mean, eliminating the temptation is very important. As long, the first few days when you're trying to stop drinking are the toughest. So eliminate any kind of temptation that's out there. You have to change your routine daily as well, because when you're, say for example, you've been doing this for 10 years where you pick up a 6-pack every time you get out of work. When you go back to work, you have to mentally prepare yourself not to stop at a convenience store and pick up a 6-pack. So you have to mentally prepare yourself as well. So there's a lot of things that a person needs to work on, but in the baby steps mode, yeah, 1 day at a time is the mentality, and it does work. And before you know it, that 1 day, 1 day becomes a 1 week, and then 1 week becomes a month, and then as time progresses, it's been, just first year is going to be the toughest, but especially the first month and first week and the first few days are going to be the toughest overall. And open up to individuals. You really need to let people know what you're going through so that they can provide any support you need. Sober buddies are a very, very good idea. If you have sober friends, sober family, they're going to be your anchor, and they're going to actually help you stay focused on what the objective is. if you hang around with people that drink, they're going to push you in that direction. And it's not going to take much of a push either. So yeah, hang around with people that don't drink or don't use, and that's going to be your best bet.
Now, being a sober buddy, some advice for being a good sober buddy. So how can we help someone stop drinking? Some great advice is talk to the person about their drinking.
Right.
So just talking and listening, right?
Exactly, yeah. There's situations also where the person might call you in the middle of the night, you know, and all they want is a sounding board. You don't have to say anything. It's like, hey, what's going on? Hey, I've been thinking about drinking, so on and so forth, and well, tell me what's going on. And they'll do most of the talking because they feel like they're feeling weak at that point in time. But, you know, like I said, just listening, like you just said earlier, just listening to the person, they'll feel like, okay, I'm not alone. I feel like I have somebody I can talk to in a moment of desperation, so I'll feel better and I can sleep at night.
How important is it to not make excuses for someone who is living with alcohol use disorder? I think we tend to try to protect our loved ones and not let anyone know, but at some point we have to sort of stop protecting them.
The person that's enabling or the codependent is always going to be in the vicinity of this person, because an alcoholic or drug addict is going to seek this person out. An enabler is going to allow this person's behavior to continue, might even lend them money, give them a ride to a store. The codependent will always cover up for the person, make it seem like it's normal behavior. Yeah, these are the people that you might hopefully try to keep away from the person. Unfortunately, a lot of times it's a family member that's very close to them. So when you have, it's a distorted way of thinking, it's very dysfunctional, but the alcoholic or drug addict is going to hide behind these people so they can continue on this trek to where they're continuing to drink or use drugs.
All right, so if you're living with someone with alcohol use disorder, the do's and don'ts. So do listen, as we talked about. Mm-hmm. Do model good behavior. So practice what you preach.
Exactly.
Do create new healthy ways to spend time together. So finding alternatives. When you used to go to the bar and play pool, maybe now you go for a jog, you go for a walk in nature, whatever it may be. But
pickleball, something.
Pickleball is the new rage, yes. So you can definitely do that. Be patient. So it's important to be patient with them and take care of yourself. So you obviously don't want to neglect your own health when you're helping someone else. Yes. And then what not to do. So don't place blame.
Right.
So it's hard
when you're blaming the person, you know, or there's a lot of finger pointing that goes on, and all it's going to do is anger a lot of people and might actually push them in the opposite direction that you're trying to accomplish. So, yeah, don't blame anybody. Just focus on, if the person needs help, try to do the best you can. Don't feel that you're putting any kind of pressure on this person. Just like you mentioned earlier, just listen to what they have to say. Sometimes that's all they want. You know, they want a sympathetic ear. Mm-hmm. You know, maybe they did some bad things that they regret when they were drinking, and they want to tell you because maybe that's why they continue to drink. You know, just be a supportive friend. Try not to be judgmental.
Some other tips: don't doubt their ability to recover. You have to be supportive. Don't nag, which I know sometimes it can be hard to not do that. And then don't compare them to others. Exactly. So every case is individual. Every patient is unique, and what they're going through is unique.
That is very true. I tell people, look, I have no idea what you've been through. I could never compare my life to yours and yours to mine. So, you know, if you want to tell me what's going on with you, then I can listen. But yeah, don't feel, you could be very empathetic. You could put yourself in their shoes and listen to what they have to say. But yeah, they don't want to be judged. A person doesn't want to be judged. No one wants to be judged. And it is a good idea to just sit down and listen and convince that person that the best thing they can do is to hang around with the people that are sober and that care about them, because they actually care about the person's welfare.
Now, you talked about that CAGE questionnaire that you can take. There's also the audit, which is the alcohol use disorder identification test that you can take. Are those something that you can find online pretty quickly as a first step if you think you may have a problem? Yeah,
you can find those online. A lot of those tests sometimes are geared to find out the severity of your alcohol addiction, and sometimes so they can kind of figure out a diagnosis for you. But yeah, a lot of these things these tests that they have are readily available, because it's just a gauge to kind of figure out where you're at in your alcohol use. And later on, there's also tests that gear your status of recovery, like how far are you in your recovery. So it varies from test to test, but it is very good, it's very beneficial, and it gives you an idea of what you're working with, you know.
And when should you seek professional help?
I mean, your best bet is to seek help when you feel things are starting to get a little bit out of control, before they get completely out of control. You know, when you see the telltale signs, and we talked about them earlier, you know, you're on the brink of legal issues, brink of divorce or separation, job loss, or inability to keep a job because of, you know, your alcohol use and your temper. All these things that you need to look at and say, you know what, maybe I do need some help. Of course, we're just a phone call away.
Mm-hmm. And there are several support organizations. So there's Women for Sobriety, Alcoholics Anonymous, Smart Recovery, Al-Anon and Alateen. Those are support groups for friends and family members of problem drinkers. So those are also organizations that you can look for. And then the Substance Abuse and Mental Health Services Administration has a lot of great information on their website. So if you are struggling, it's really important to seek help.
That's right. You know, and like you mentioned, Al-Anon, Alateen, these are people that are living with someone that's dealing with an alcohol drug issue, and they feel sometimes like there's no one out there for them. This is a support group to let them know, hey, you're not alone. We're here to help. We're going through something very similar, and we're just here to support what's going on with you. So a lot of the groups that you just mentioned, most of the groups that are on that list, seek to try to help you get to a certain point, and they're just there for ultimately just for support.
All right. Well, thank you so much, Alberto. We really appreciate your time. This has been some great information that we hope our viewers will really appreciate.
You're very welcome.
All right. And that officially concludes our webinar. Thank you for joining us. We hope you'll continue to prioritize your mental health as well as the mental health of your loved ones. Now, if you are experiencing a mental health challenge, STHS Behavioral is here to help. For more than 30 years, the facility has proudly served the South Texas community, offering both inpatient and outpatient treatment options. If you or a loved one is facing a mental health concern, you can schedule a confidential assessment by calling our hotline at 956-388-1300. And please remember, you are not alone. Talk with a loved one or seek professional support whenever you need emotional or mental health assistance. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Lifeline at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, April 2nd, broadcast live at 5:30 via Facebook as we discuss stress management. We hope you can join us. And to watch our previous Let's Talk Mental Health seminars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please continue to prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.